Globally, postpartum depression is one of the most common but often unrecognized complications of childbirth, yearly affecting about 10 to 15 of postnatal women, and these symptoms can occur anytime in the first year of postpartum. In Nigeria, there is poor knowledge of postpartum depression amongst postnatal women and poor recognition of its symptoms by health practitioners. Postpartum depression can interfere with normal maternal-infant bonding and adversely affect acute and long-term child development. Postpartum depression onset usually begins between 2 weeks to a month after delivery. Postpartum depression, which can also be regarded as a mental health issue, doesn't only happen after childbirth, but can also occur in women who have suffered a miscarriage. It is, however, important to note that a woman shouldn't be despondent, as this isn't a flaw or a weakness. Sometimes it is as a result of combination of physical, emotional, genetic, and social factors. Research notes that when a woman is diagnosed of postpartum depression, prompt treatment can help manage symptoms and help mothers bond with the baby. Some health officials shed more light on what postpartum depression really means and also spoke on reasons that might increase the risk of the mental health issue.
Postpartum depression is a psychotic disorder. Mostly it affects mood. It's a kind of depression that occurs after a woman puts to birth, like the word postpartum, after postpartum. When a mother is going through postpartum depression, it affects the child, honestly, because it could lead to the mother not properly breastfeeding this child. So there'll be lack of bonding between the mother and the child. And in cases of whereby a mother has postpartum depression, you don't really put the child without supervision close to the mother, because anything can happen. This is a woman who is depressed, and in a depressive state, you might be tempted to do one or two things that you might regret later in life.
Postpartum depression is a state of extreme sadness and mood swing that occurs after delivery.
Furthermore, Nwokoro Ijeoma, a nursing official, shared her opinion on how postpartum depression can affect the relationship between the mother and the child.
When a mother is depressed postpartumly, the child can't be left alone with the mother. There have to be an adequate management, or you have to monitoring, supervision between the mother and child, because it's possible that the child and the mother might want to even kill the child, or we've seen cases whereby the woman says this is not her child because she's not in the right state of her mind. So because of that, there'll be impediments, which, like breastfeeding, the mother might, in some cases, the mother might be unable to breastfeed the child. They might have to initiate infant formula. There'll be lack of bonding between the mother and the child.
However, evidence has showed that psychological intervention is required after childbirth, as support is an important aspect of prevention. These health providers further explain how postpartum depression can be prevented.
We advise that when a woman is pregnant, she should be surrounded with people with a lot of loves, you understand? Because you don't know what is going through that woman. You don't know what is going through her emotional mind. There should be a lot of support from the family. Don't leave a woman alone during pregnancy.
The woman should be cared for during pregnancy. The husband should also accept the pregnancy and be by the woman's side. The society should also support by giving affordable antenatal care, because if antenatal care is expensive, husband denies dropping money, the woman feels sad. And the hormone in her, which is also over-secreted, will also affect her thinking and make her to feel sad, and then feel like mood swing, suicidal attempt, and other things.
Postpartum depression has significant impact on the mother and long-term consequences on the cognitive and emotional development of most children whose mother are affected. However, social support for women both in the pre- and postnatal periods, and routine screening of women and postpartum depression should be encouraged for early detection and immediate intervention. Yetunde Otolorin, KAFTAN Television, Lagos.